Good evening, and welcome to Community Immunity. This is a series of broadcasts that we're talking about COVID awareness, access, and acceptance, particularly in the Black community. And so, what we're doing is we're going through regional and state by state to find out what's going on specifically as to in terms of the uptake and the acceptance of vaccinations by Black and Brown communities. And so we did Alabama on Tuesday, and that was a wonderful, wonderful show. We've already done Texas, we've done California, we've done Atlanta, everything. And so tonight we're staying in the South because we have noticed that when we looked at the numbers, the South has been lagging behind with regards to vaccine uptake and acceptance. And so tonight is all about Mississippi. Yes, that state that you learned how to spell when you were a little kid. M-I, crooked letter I, crooked letter I, humpback I. We are talking about Mississippi tonight. So that is where we're starting, but I got some stats that I want to talk about with Mississippi. So the U.S. vaccine rates have been, to date, there have been 305 million plus doses handed out. 141 million Americans are fully vaccinated, and that's about 43% of the eligible population. In Mississippi, they have, about approximately 3 million residents in the state of Mississippi, there have been 1.82 million doses of the vaccine given out of either one of the three. 832,000 people approximately are fully vaccinated, and that's about 27.9% of the population. So as you can see, they are behind the rate of vaccinations across the country. Black Mississippians, there have been 350,000 plus doses administered, 306,000 plus Black Americans in Mississippi fully vaccinated, and that's about 36% of the population. So what does that mean? That means approximately 1 in every 4 Mississippian citizens are vaccinated. So that means if you get on the elevator with 3 other people, you might be the only person that's vaccinated on that elevator. And if you're not vaccinated, only be one other person. And in terms of Black Mississippians, that means 1 in 3 Black people are vaccinated. So it's really behind where we want to be because, as we know, herd immunity requires, they're saying the number is about 70% to reach herd immunity. And so we are well behind. And I say when we're talking about 36%, and the president is picking July 4th as his date that he wants to try to get more people vaccinated. He's already talking about buying and sending vaccines to other countries where, well, we haven't even reached 50% coverage here in the United States. So we've got to do better. But we had to find out why. And the only way we can find out why, what's going on in Mississippi, is to talk to people that live in the state, that work in the state, and that are from the state. We can't talk about Mississippi when we not from there and that don't understand what's going on in Mississippi. So we have a full panel of people talking that are from Mississippi, that work in Mississippi. We've got doctors, we've got nurses, we've got private citizens, we've got former mayors that are going to come on tonight and tell you what's going on in the state and what we can do in order to improve the vaccines in the state of Mississippi. So I know you didn't sign on to see me continue to talk. So I'm going to bring on our first guest, and this is Dr. Fred Kinsey Jr. Good evening, Fred. How are you, Dr. Kinsey?
I'm doing well. And yourself?
I am doing well. Dr. Kinsey is an emergency room. He's a Department of Emergency Medicine at Baptist Medical Center right there in Jackson. So Jackson is the capital, if I'm right on that, it's the capital of Mississippi. So first question for you, Dr. Kinsey, is this. In your role as an ER physician, have you noticed a change in the type of patients that are presenting with COVID?
Big time. In the last few months, we've had a drastic drop in the number of patients who have presented both with COVID needing admission to the hospital, meaning that they need advanced respiratory support. And we've had a total drop in just patients who are presenting with a febrile appearing illness that tests positive for COVID. So we've seen, I know at the peak of the times where we were seeing COVID back in July of last year, around November of last year, around the early parts of this year, there were some days where I worked 12-hour shifts, both days and nights, just depends on the schedule. There were some shifts where more than half of my patients would be COVID positive patients. And then of those 12, 13 patients, probably 10 of them were getting admitted to the hospital for some type of advanced respiratory support. And I can tell you now, in the last, I just came off of a string of night shifts over the last 4 nights, and I did not admit a single COVID patient. I did see one tested positive, but they were not of the illness severity that required admission to the hospital, so they were able to go home. So it's been a huge drop in the number of patients that we're seeing, and we're kind of getting back to seeing more of the bread and butter things that come through the emergency room.
What do you attribute that to? Do you think that is just because people are being more cautious in terms of, because I just laid out the numbers in terms of people aren't and many people aren't as vaccinated. So do you think that's because people are being more cautious with regards to wearing their masks, washing their hands, watching their distance? What do you attribute the drop in terms of people presenting with COVID to?
Yeah, we've had this discussion multiple times, both in the office at work with friends who are emergency medicine physicians and other physician types across the country. Why are the numbers dropping so fast, yet our vaccination rates are not as high as we would want them to be? I think it's actually a conglomerate of things that are going on. One, lots of people have been vaccinated, at least the ones who are more likely to succumb to the COVID viruses and actually have morbidity. So our older patients, the nursing home patients, a lot of those patients got vaccinated very early on, especially in Mississippi. And Mississippi was one of the first states that opened the doors to literally vaccinate anybody. We were one of the first states where you could literally drive up in your car and get a vaccination at a vaccination center. And at that time, we had patients coming from Tennessee, driving up from Louisiana. We had patients flying in from Illinois. I mean, we had patients coming from all over the country because we were one of the first ones to open that door to everybody. So having the sickest people vaccinated first helped a lot. Obviously, keep a lot of people out of the ERs because those are the ones who are going to, be more likely to need to be admitted to the hospital. The ones who are over the age of 65, have diabetes, hypertension, live in a nursing home, have all the other comorbid conditions. Another thing is we've had a lot of people who have had COVID. I mean, the sheer number is just high between the people who have had COVID and were symptomatic and the people who had COVID and were not symptomatic, but still developed antibodies to COVID. That's that's a pretty high number of people who, even though they did not have a vaccination, they have antibodies in their blood that are protecting them from getting COVID, sometimes a second time. So, you got that double whammy right there. People who have vaccinated, people who have had COVID, and then you have that kind of third area, people who are just being very cautious when they go places. Though our state has dropped our mandatory mask mandates in a large portion of our state, I still go to places now. I was in Lowe's a couple days ago and Kroger a couple days ago. People are still wearing a mask. The people who are highly concerned and feel that they are still at risk are still wearing their masks. They're still washing their hands. You see them clean their hands before they get that buggy. You see them clean their hands after they get their credit card back from the cashier. It's definitely 3 parts. Like we were discussing, it's the people who've gotten it, the people who've gotten vaccinated, and the folks who are just being very cautious. I think that trifecta is kind of helping keep our numbers down, and I pray that it eliminates this virus very soon.
So, are the people that present, are they coming in younger in terms of people that are presenting with COVID? Since, as you mentioned, the older populations have been getting vaccinated.
Yes, the ones that I have seen in the past, I would say month, 5-6 weeks, have been more of the younger population coming in for, the majority of the time I would say flu-like symptoms. I want to get tested for the flu. I'm like, no, you don't have the flu, you have COVID. And usually, our 21, 22-year-olds who are fairly healthy, they're just the lounges have opened back up. The places where they socialize and mingle have opened back up. So you're at a higher risk of spreading spreading this virus in those locations. So obviously, it was pretty obvious that we were going to start seeing more of those younger people. But luckily, with a good immune system, with the young age, not a whole lot of comorbidities, meaning diabetes, hypertension, obesity, smokers, that those patients usually do really well, and we don't have a high number of those patients requiring advanced respiratory support in our hospitals.
Okay. So have you noticed the way you've treated COVID patients, has that changed since the beginning, since last year? I know March, when we're still trying to figure it out, has the way, have y'all gotten up, has science caught up to, oh, this is how we handle a COVID patient versus the way it was when it first started?
What I can tell you, speaking from colleagues at different hospitals, there is no standardization of how we treat a COVID patient. Okay, so if you, let's say, I'll give you some examples. If you came in with pneumonia, and I could take your age, I could take how many medical problems you have, I could take if you've been on antibiotics recently, and I can put that in an algorithm and say, based on this, the data says that I should put you on this antibiotic for this number of days. Okay. Mm-hmm. And if your O2 sats are too low, I should put you in the hospital for advanced respiratory support. For COVID, even though we've had it for over a year now, there is truly not a standard. There are some hospitals who will let patients go home with their O2 sats in the low 90s, as long as they're not breathing too hard, as long as their chest x-ray isn't too bad, as long as they have some type of support at home that can identify that they are getting worse and can bring them back. And then there are some hospitals where if their O2 sats are, mid 90s, meaning that the amount of oxygen attached to the blood is 95%. If that patient is breathing 22 times a minute, they'll admit to the hospital. So the standard of how we treat it is variable. Every hospital kind of has their own kind of algorithm, and a lot of times that's driven by the hospitalists, the ones who take care of the patients upstairs, and also pulmonologists, the lung doctors who take care of the patients when they get upstairs. They're the ones that kind of direct which patients need to stay, which patients we give a chance to go home and try it again. Since COVID has come out, obviously there has been a whirlwind of things people have said will work or possibly work. Everything from baby roots out of somebody's garden to garlic and some onions and we've been kind of back and forth and all over the place. I can tell you that most hospitals still have a standard that patients are taking vitamin C. They do high dose vitamin C's. If you have an oxygen requirement, most places are doing steroids still.
Okay.
But for patients who go home, usually we recommend vitamin C, rest, isolate yourself away from other people, and don't try your best not to spread this at all. From a inpatient, from people who go, we do have this small class of people who are well enough to go home, but they have a lot of comorbidities, meaning that their potential to do bad is there. The way COVID works, statistically, from the time you first see symptoms, these patients usually, if they're going to do really bad, do bad somewhere between day 7 and day 11. Okay. If you feel really good or not great, but because COVID is a virus and it makes you feel icky, if you're doing well on day 5 and 6, that doesn't tell you a lot, honestly, because a lot of patients who were, mentally thinking they were going back to work on day 7, and then they wake up that morning and it's like boom, and it's like start all the way back over, and they're wound up in the hospital, in the ICU, on advanced oxygen support. So day 7 to day 11. So we know that if we can identify those patients who are most at risk to be a patient to do poorly, obesity, diabetes, hypertension, smokers, people who just have high risk factors, there are some medications that we are giving They're called monoclonal antibodies.
Yep.
And essentially what that is, it is a genetically manufactured antibody. So when a virus comes into the body, think of it like this, a basketball. It's a big sphere, and it has these little spike proteins on the outside of it. That antibody, what it does is that it works like a grappling hook to that spike. So if you can flood a body with antibodies, that antibody attaches to that spike. And once that antibody has attached to that spike on that virus, it is completely immobilized. It doesn't work anymore. And it will just drag that viral particle out of the body. So the goal of monoclonal antibody therapy is that if we give it to the patients who are most at risk of having a bad outcome, that we can flood their body with these antibodies, try to decrease that viral load as fast as possible, and hope that they don't have a poor outcome when they hit day 7, 8, 9, 10.
So with that being said, what's the argument for getting vaccinated? If they if I know if I can go in, I've got this date between 7 and 11. You got the monoclonal antibodies that you can give me. What's the argument for somebody to get vaccinated ahead of time?
So the vaccination is your body's ability to create your own monoclonal antibodies, right? Monoclonal antibodies are ones that are built in a lab. That vaccination does the same thing naturally for you. It's going to create antibodies in your body. Personally, there's a lot of reasons why. One, financially, it's not free. So if I was to get COVID right now, you can walk into any Walgreens, Walmart, health department, anywhere, and get a free COVID vaccination. It may cost you a day of work because you have fevers or body aches or not feeling well the next day. But overall, that's a free vaccination. If you come into a hospital and you have these comorbid conditions that make you more likely to have a poor outcome, if you have to get the monoclonal antibody, those aren't free. They're actually very expensive, very expensive. And if the monoclonal antibody doesn't work, because the sooner you get it, the better. But if you have 90 people that need the infusion, and our hospital can only do 10 per day, and you have to get it before you're at day 7, you're not going to qualify. You're not going to make the cutoff.
Okay.
So one, that you even though you need it, you may not be able to get it. Even though we know it works well, we know that it's had some very positive outcomes, you may not qualify for it. There are still exclusions for the monoclonal antibody. And then the third one is that with any medication, just like with the vaccination, there are risks when it comes to giving this monoclonal antibody infusion. I haven't seen any personally at our facility, but I do know there's a risk of anaphylaxis, there's a risk of hives, there's a risk of, all these different things. So if I'm going to take the risk, I'm going to take it very early and try to prevent everything downstream. I don't want to be, circling the toilet trying to take those risks at the end. So.
I got you. Last question for you is that what are you hearing from community members? What are you hearing from patients about the vaccine as to help you think as to why people aren't getting it as much as they should?
Honestly, I can tell you that when the Johnson & Johnson hit the market or hit the news waves and was having the issues with possible blood issues, meaning your platelets being kind of low and being causing clots in the brain for some of the females that it happened. That was a huge, I think, jab in the ability to put these vaccinations in people's arms. Even though statistically, and it's hard to get people to understand how statistics work, you've given a vaccine 7 million times and 7 people had a problem. That's good, so that means the likelihood that that's going to happen to you is statistically the same as the likelihood that you'll walk out on a sunny day and be struck by lightning. But it's hard to convince people that's the same issue because, in their minds, it's stuck is that somebody, wind up in the ICU from that virus, from that vaccination. And I got, my entire neighborhood, multiple people have had COVID and no one had problems. And so it's kind of hard to make someone understand that even though this has happened, this is still the best choice. This is still the best option, not just for you, but for your aunt, your uncle, your grandmom, anybody else that you could possibly infect. And one of the things I try to harp on when I have young kids or younger people that come through my ER about vaccinations, and I tell them about patients that I've had who I have to explain that I'm going to have to admit your grandmom or your granddad or your uncle or aunt, and they know that they're the reason that they have COVID because they went to a party, they went out of town, they got COVID from somebody and then gave it to someone else that lives in their home. Imagine having to carry that burden for the rest of your life if that person doesn't survive their COVID. I mean, it's a tough thing to carry. And I've been successful in convincing some people to say, okay, yeah, that makes sense. I'm gonna go get my one shot. The community that we serve are very adamant about the one shot vaccination, the Johnson & Johnson, because they don't have to go back to that kind of stuff.
Well, that's good. That's good to know that at least they're listening, and at least some of them are making that decision, and especially now that the Johnson vaccine has been reinstated, because I think they've identified, the people that had clotting, why they're having the clotting. So I think they've identified that, and so that's why they were able to take the pause off and get back in the circulation. So that's good. So I know you have to go. I know you got to get back to the hospital. So thank you so much, Dr. Kinsey, for joining us. We would like to have you on again in the future because this has been a wonderful conversation, and we look forward to talking to you again soon.
Definitely, I look forward to coming back.
All right. So. Next up, we'd like to bring on one of our national specialists. This is Dr. Michael Lenoir. He is well known to Black doctor. He is a past president of the NMA. He is a well-known, I want to say world-renowned, I have to say world-renowned asthma and allergy specialist. It's a little joke that we have between us. And he also is a host on Black Doctor every Wednesday night at 9 p.m. Eastern. We have Wellness Watch presented by the African American Wellness Project that he runs. So welcome, Dr. Lenoir.
Well, thank you very much for having me.
So you just heard Dr. Kinsey talking about that, and you heard all the statistics. What are your thoughts when you hear his responses to what's going on there in Mississippi, how they're working in the emergency room, and then you hear the statistics that I mentioned earlier about Mississippi? What are your initial thoughts?
My initial thoughts are that Mississippi is not that much different from a lot of other states. I think that he's right about the way in which the Johnson & Johnson troubled vaccine halted a lot of people's interest in getting vaccinated. Here in California, I think our problem is very similar but somewhat different. And maybe it's something that we have uncovered. I also, for most of my career, have practiced primary care as well as consulting allergy and immunology. And we had an opportunity to talk to older African Americans about getting vaccinated. And it turns out that older African Americans were getting vaccinated. Then we had the opportunity, once they started to change some of the dynamics and allow for more broad-based vaccination, to talk to younger Black people who have children. And 9 out of 10 of those patients are not getting vaccinated, nor are they having their children vaccinated. And I think that's going to be a much bigger problem as we try to get the African American community, which disproportionately still suffers from both deaths and disease more than the rest of America, to get the vaccine. And I don't think it's going to be very different for a lot of the population that is non-African American. Younger people are just not interested in getting this vaccination. And I think it's because in many instances, they have different information sources, many of which may not be grounded in the science.
Right. Yeah. Social media, can be full of information, but it also could be full of disinformation. So one of the things that you and I have talked about before is this variant. And I know that they have named one of the variants, and I don't know why they call it the Delta variant. Maybe they had Alpha, Beta, and Gamma prior to that didn't stick as long, but now they were up to Delta. So this Delta variant that has been coming, they've identified in the country of India, and now has been making its way around the world, has been a big concern. What are you hearing about the Delta variant, and what concerns you have about it circulating around our population here in the States?
Well, it was originally called the Indian variant. And I think you know why that was changed. Obviously, it was not the proper thing to say, at least in India, especially. Variants are really imperfect manufactured viruses. As viruses increase their infectivity around the world, the number of particles that are developed increase. And many of those particles are imperfect, just like any other biologic process. But as being imperfect, that means they don't make the perfect COVID-19 virus. But they make a virus which has more competitive characteristics. That means that this is a virus that is more infectious, causes more significant disease, and is more prevalent among young people. And I think this is just one, we're just working up the ladder. Each virus, each variant is probably, or each round of variants, because there are a lot of variants made that don't cause any more difficulty. But each variant that is able to escape the process is going to be more and more dangerous to unvaccinated people. And hopefully it may get to the point where we get a variant that is a danger to vaccinated people. And so the people that are unvaccinated, that means more viral particles, more variants, and more opportunity for these variants to have the kind of characteristics to prolong the pandemic, not only in the countries where they originate, but around the world.
So, okay, so that's a good reason to go ahead and get vaccinated. So that reduces another host for a potential variant, a new variant to develop. And so that's the layman's term. I know you said it so eloquently, Dr. Lenoir, but the layman's term is this: we got to reduce the number of hosts for variants to be able to develop. So thank you for that. A couple of rapid fire questions that I know I've even seen these comments before. Are the vaccines safe? All three, whether it's Moderna, Pfizer, Johnson, are they safe?
I think they're all safe above the 80% level, 90% for some of the vaccines. And I think that that still means that for 10% of the population, there's the risk that they won't be affected. But in general, they're some of the most effective agents that have been developed.
Do they cause any infertility or alter any of your DNA if they're put into your body?
You know, the DNA is intracellular. They don't affect the DNA at all. There's no. It's a messenger RNA issue to make a different response to the spike protein, so that your body recognizes the spike protein when it comes along, when it's being driven along by the coronavirus. So I know it doesn't have any impact on your DNA.
Okay. What about fertility? I know that's been a big question, especially in Black community. Does it cause any infertility? Does it disrupt your reproductive process in men or women?
I would say to date, no, there's no evidence that it affects fertility. But here again, it's a new virus, but all the evidence we can see, there's no impact on fertility.
Okay. So those are, I think I've gotten through. Let me see. One more. Okay. Question is, now that we know that when we look at a map of the United States and we see where the high rates of vaccines are and the low rates of vaccines, there's a noticeable trend that the areas where there's a low vaccine uptake rate, those states were more conservative in nature, and the states that have had a high uptake of the vaccine are more liberal in nature. Do you think that this politicalization of the vaccine is going to change anytime soon to where it becomes more of a health issue versus a political issue?
You know, I do not. I think that if it's going to change, it's going to be more of a sociologic issue, that you won't be able to get into a basketball game, or you won't be able to go to a concert, or you might not be able to go on a plane. I think as things, you may not even be able to work in certain places.
Okay.
Here in California, we're having nurses who didn't want to get vaccinated are not welcome at the hospitals where they worked. And so consequently, I think what's going to change it is what's changed a lot of instances with vaccinations. I don't think in this country so divided politically on such ends of the spectrum in such an unfortunate way that the politics of this is going to change. But I do think the opportunities for you to move freely through the society, do the things that you want, are going to be limited because businesses, venues, other institutions, even maybe some school districts are going to insist that you prove vaccination. And I think ultimately it's going to come to the same thing that measles, mumps, rubella has come to in California, where you cannot go anywhere unless you're vaccinated.
Well, absolutely. When we did the California show, we had a representative that was a professor at one in the university system there, and they said that the university system is requiring now students, if they're going to return to campus, they have to be vaccinated. So you're right about that. And then we've got there's a hospital system in Houston. When we did Texas, there's a hospital system there in Houston that is being sued by some nurses for them mandating vaccinations of their employees. And so it's now, so you're right, it's going to be more of a sociological issue versus than a political issue. So I think that's a very good point. Last question for you, Dr. Lenoir, is this. Now that the vaccine has been expanded down to children at the age of 12, do you think that that would have any impact on maybe more vaccinations happening as parents are wanting their kids to be vaccinated before they return to school, knowing if they go back into a school full of and have exposure to a whole bunch of children that they don't know, that they might feel more inclined to have their child vaccinated to be protected as they return to school in the fall?
I think that, but what happens though is when you start talking about messing with people's children, you get a lot more hesitancy about being aggressive with the vaccination. I think here in California, until they made it mandated, we had almost 40 to 50% of the parents either wanted modified schedules or no vaccines at all. And so consequently, I think that I think it's going to be difficult, more hesitancy the lower you go. And when you start getting between 12 and 5 and 5 and 2 and infants, you're really going to have some real serious discussions with your parents, because they will do things for themselves they would not allow to be done for their children.
Absolutely, absolutely. Well, Dr. Lenoir, we thank you for joining us today. If you can, I know you're at your office because California is still work hours over there. But if you can, hang around and we'll bring you back at the end to get your final thoughts.
I will if I can.
Okay, thank you. Next up, we'd like to bring on a private citizen now, but he was a mayor of Holly Springs. This is Andre DeBerry. He's a former mayor of Holly Springs, and he's going to bring a unique perspective, because what we'd like to do is find out, because he's a private citizen, but he was a public servant, and how those two worlds collide when it comes to a public health issue like the coronavirus and COVID has been. So welcome to the show.
Thank you, Ellis.
I'm calling you mayor. You're always a mayor. What's your mayor always says?
Thank you, Ellis. Appreciate
welcome
it.
to the show. That's my first question. Put your mayoral hat on and say, how would you deal if you had this public crisis happen, health crisis and you're the mayor? How do you think you would have responded as a civic leader to help your constituents overcome and beat COVID back to where you're not having people get sick and die under your watch?
Thank you. That's a very, very good question. And I think as Dr. Lenoir was just saying, it is very imperative and important that people believe that they have buy-in in the final discussion and the final decision. If I were mayor, had been mayor at that time, well, obviously we would have called in city administrators, persons from the business community, health community, the religious community, and bringing all those sectors in and really developing a strategy. But one of the issues that's causing many concerns with many rural communities in Mississippi, and not only rural communities, but a lot of lower in terms of population as opposed to major cities, but higher in terms of population in terms of small towns, is a lack of a medical delivery system. in Mississippi alone, we have some 21 hospitals out of 31 that have closed over a period of time over the last 10 to 15 years. And much of that is because of the lack of the expansion of Medicaid. So what you have here is people that are traveling sometime in excess of 60 to 65 miles for something as simple as emergency room care. So obviously, when you start talking about a vaccination and a delivery system, many of these people that would be going into hospitals, for instance, here in Holly Springs, I actually got my vaccination at the local hospital here, Lions Healthcare, which is actually operated by a Black doctor, Kenneth Williams, who has a clinic here. He's a product of Meharry Medical School and former Mississippian. And he's actually the manager of the hospital, and actually the hospital is owned by the county. But they actually set up, most of the people in this area actually got vaccinated from that hospital. But many people had to travel. I think, as I heard the doctor from Jackson say earlier, many people were actually traveling from North Mississippi to the coast, to Jackson, all over the place, because they could not find places that were actually vaccinated. But if you look at one of the major issues that we're having here is in terms of getting information out. I know you talked about social media, but many of our traditional disseminations of information places are closed. Churches, fraternities and sororities are not meeting, social clubs are not meeting, motorcycle clubs are not meeting. These places that people would normally be going to on a consistent basis, at least on a monthly basis, sometimes on a weekly or bi-weekly basis, to get information on one-on-one. So what we're getting is we're asking people to go to CNN, MSNBC, ABC, CBS, definitely, hopefully not going to Fox, getting some of this bad information they're getting, but asking people to actually sit down and be proactive. And many people are not proactive. They get information secondary, tertiary, and third, or in some cases fourth. But the fact that we have doctors like we had on here tonight, I just come back from an annual visit today, but many of us do not go to facilities. And so I was talking to a young lady there in the doctor's office, and I asked her if she had been vaccinated, and she said no. And she said she had been vaccinated, but her son had not been. And I was asking her why. And I think she said her son was 21 or 22. And he started talking about all of the implanting of in our systems, or putting chips and the whole thing with Bill Gates and all this kind of stuff that they get off of social media. But it's interesting that information, and Ellis, that once something starts, it starts as a spark, but eventually it smothers to a little broader smoke, and before you know it's a raging fire. So these people are taking disinformation, and people tend to want to accept something that comes closer to their own beliefs in the first place. They had skepticism already. And so now somebody has validated it with something outlandish, but at least validates their point. But I think we've got to try to find a way to get, and I think we're doing a better job of it. But Mississippi, I think, is a unique state in that we've always prided ourselves to our own detriment that we're the most conservative state in the union. And they wear that with a badge of honor, If the rest of the states are getting vaccinated, then we're going to show that we have Fourth Amendment rights, and we have First Amendment rights and Second Amendment rights, and so we're not going to vaccinate, But I think, and then you have to have leadership. And most of the places we have governors and legislators who are not doing what they need to do. But I think in spite of that, I think as Dr. Lenoir was saying, eventually, as we get back to a situation where people's lives will be impacted if they're not vaccinated, then I think then it becomes more of a critical issue now, because now it's more personal. Right now, it's almost like it's somebody else. It's not here. But when it comes down to the point where you can't get into a facility, or in some cases you can't walk into a building, or in some cases you can't go to school. And I heard Dr. Lenoir say, but we think about the majority of our students that are in pre-K and secondary, post-secondary, secondary education are in fact vaccinated 3, 4, 5, 6, 7 times sometimes before they even go to school. So that has been my question to many of the parents, is that if you can vaccinate your children for all these things, and all of these vaccinations when they came out, these vaccines when they came out were new.
Right.
They're not new now because we've done them for a while. But I think nothing old, everything old has to start new, has to begin as a new. And I think that's the impetus that we have to give to people, is that somebody has to be the first. We're the generation of the first to get the COVID vaccination. And 10 or 15 or 20 years, it would be thought of just as we think of smallpox and polio vaccines now.
Yeah, that's very, very true. So, you've got Mississippi Pride situation. We've got this disinformation, and the difference between disinformation and misinformation is disinformation is when you're putting information out there that to be false, and you're still putting it out there. And so that's why I call it disinformation. So people know they're putting out false information, and they're still doing it anyway to muddy that water. So we got disinformation. We've got a rational, real-time distrust by Black people of government, especially government-sponsored medicine, right? And so, because we're talking about what's happened in Tuskegee, we know that. I've done shows about what happened with Tuskegee experiment. We know about Henrietta Lacks and all of the minor aggressions that happened toward Black people. The maternal mortality rate is off skew. We know the life expectancy is high. So as Black people, we generally have a documented distrust of medicine. How do we overcome all of that to say, okay, we know this is safe, and we know that this is going to keep you and your family safe?
Well, I think, as I said earlier, when we can return to those points and places where we have people who can disseminate information to us that we have a level of trust in. Let's face it, one of the most trusted persons in the African American community is a pastor.
Right.
He's the one man or woman that can come into and make a statement, and somebody can come home and say to their wife or to their husband, "Pastor said this."
Pastor said.
And so it's very critical that these institutions, the fraternities and sororities, on a national level, on a regional level, on a state level, and even on a local level, we've got to talk to our memberships personally. And then as we're going into our meetings and other social clubs and civic groups and saying to people, look, I got vaccinated. My wife is vaccinated. My brother's vaccinated. My sister's vaccinated. And when we begin to start seeing that we're not the only ones out of the 300 plus million people in America that are being vaccinated, then we no longer have that fear. We become a part of the community and a part of the village, as opposed to one who has been singled out. In some cases, that's what people, because when you start talking about the Tuskegee thing and you start talking about, people are looking for reasons to say no, as opposed to reasons to say yes. It was interesting. I'm not long, but I was watching on MSNBC where the sister who actually developed the Moderna vaccine was on the town hall, and the young brother who was somewhat hesitant, and she talked to him, and after the show was over on Lawrence O'Donnell's show, and she persuaded him. And he went home, and after talking to her and getting the information, he went home and talked to his mother. And she came down and actually went to the vaccination site and saw them. It's that kind of one-on-one piece that we're going to have to, when we say one person at a time, that's what's going to have to happen in the African American community, because Ellis, we're not people who follow along quickly as a flock of sheep. Sometimes it's like herding cow cats when you deal with us.
Especially for something new, like if it's something that's been established, we might go along with it. But if it's something new, you're gonna have to convince me. I don't care what you say.
And as quiet as it's kept, now I have to tell people. Now this might sound like a blanket statement that I can't prove, but I think you can, and I can. We are a very conservative people.
We are.
A very conservative people. And so when you start talking about new things, it takes us a while to adapt and to want to acquire something, that a new idea or a new process, because we're so used to doing traditionally what we've always done.
Right.
And so now when you're asking us to do something that we've never done, and we're some of the first to do it, it's a bit of skepticism. But I think as Dr. Lenoir was saying, I think we've got to be vigilant, and we've got to be persistent, and it has to be a movement. Just as we have a civil rights movement, we got to have a movement now to actually survive, medically survive.
I like that. I like that. This is a survival movement. Okay.
It's a survival movement.
I like that. So hang around. I can talk to you all night, Brother DeBerry.
I'll be here.
It's been wonderful. So hang around. We're going to do a panel discussion at the end of the program. Thank you. So we'd like to bring on some private citizens. We just talked to some doctors. We've got an emergency room doctor. We talked to a national doctor with Dr. Lenoir. We just talked to a former mayor, a civil servant. But we're going to talk to some private citizens and find out what's really going on. So we're going to bring on Steve Campbell, and we're going to bring on Dorothy as well. Dorothy, I think it's Bennett is your last name. Is that your last name, Dorothy?
Last name Everett.
Everett. I'm sorry. I was close. I knew it was two T's. I there was some T's in there. So Dorothy Everett. So Dorothy, where do you live? You're in Holly Springs?
Well, I'm from Holly Springs, but I live in South Haven, Mississippi. And
Okay.
that's like 45 minutes away from Holly Springs.
Got you. And Brother Campbell, you're from Jackson, correct?
I am from Jackson, lived in Atlanta. My mother still lives in Jackson.
Amen. Amen. So, Dorothy, let's start with you. I know when we talked earlier, you said you were vaccinated. What prompted you to get the vaccine?
Well, one thing was my health condition, because I have underlying conditions.
Okay.
And there's them ones who end up with the COVID because I deal with asthma. So I know it attacks your lungs. And so that was one of the reasons why. And another reason why, because of my mom also being afraid that when I go visit and not, by me being around different people, especially where I work at, and didn't want to come home and just, bring her anything. And then I have small grandkids as well, too. So I wanted to protect them. So that was the reason.
Okay. And Steve, what was your thinking about the vaccine?
Well, simply, I was like Dorothy. It was really about my mother. I'm very healthy. I never get sick, but I did not want to take a chance of me catching COVID, being asymptomatic. My mother had just retired. She's 71 years old, and she's in great condition, great health also. But just the fact I did not want to be, and I've had so many of classmates that we had that attended Florida A&M that aunt gave it to the sister, who gave it to the brother, and I just didn't want to be a part of that. So I
Right.
wanted to make sure my mother, like I say, she's 71 years old, and she's going to, and most people gonna know, most people in Mississippi from Mississippi live for a good long time. And I didn't
Right.
want COVID to prevent that from happening with my mother.
Right. Absolutely. So what was your experience, Dorothy, when you got it? What was your experience? Did you have any symptoms? Were you sore? What was it like for you? And which vaccine did you get?
My experience was, I really didn't even have any experience with it. I got the Pfizer. After I
Okay.
got my Pfizer, the only thing I experienced was my arm was a little sore, and I didn't get any fever or anything. So I really didn't experience anything. Praise God.
Amen. Steve, how was it for you?
Zero. I was laughing because I saw people posting, oh, I'm down for 2 or 3 days. I had a fever. I got it and didn't even realize I had even been jabbed, first of all. And, went to get something to eat. And I was like, well, maybe an hour or two later, maybe 24 hours later. And again, I got the Pfizer vaccine and I had zero side effects.
Absolutely. I can speak on that too. I had a sore arm for about 2 days, but I didn't have any of the other symptoms. And so that brings a curious point. So when a lot of times when we do these programs, people will talk about vitamin D and other immune boosting things that you can do. And I would say, do those and get the vaccine. And somebody was asking me about when they were about to go get vaccinated, they had their appointment out and they said, what should I do? Because they were afraid of the side effects. I said, start taking vitamin D, drinking water, and eating immune boosting foods, because that will help you overcome those symptoms. She still has symptoms, but it wasn't nearly as bad as she thought they were going to be. And she said she owes it to that boosting. So Steve, I know how healthy you like to keep yourself and the things that you do to stay healthy. And so I'm not surprised at the fact that your system was probably already pretty healthy. So when you got the vaccine, it's like, okay, cool. And now you've just taught your body how to deal with COVID if you come in contact with it. So, Dorothy, what are your other friends and family? Are they vaccinated? And if they're not, what are they saying as to reasons why they're not getting vaccinated?
Well, I do have a couple of friends that haven't got vaccinated because of they are afraid of what might happen if they do. But I explained it to them. I'm a living witness. I got mine, and you see, hey, I'm perfectly fine. But I do know a lot of them saying that they're afraid.
Right.
So,
I
but
get
I
you.
keep encouraging them, letting them know that it's very important for you to get vaccinated because we have seen a lot of people lose their lives. So, and I just don't want to be that one. And I thank God right today that I am not that one. So I just encourage anybody who haven't taken it to go ahead and do so.
Absolutely. Steve, I'm going to ask you this. You're from Jackson, so you kind of know the sensibilities of Mississippians. What do you think it would take to get more Black Mississippians to get vaccinated? Is it the connection to like your story is about wanting to protect older family members, or is it something that knowing that a friend that has gotten it that they didn't have a reaction or bad experience with the vaccine? What do you think it'll take?
I think it is simply knowing somebody and then letting them have faith that you're fine. I send out this joke at least once a week. I tell people, guess what? My eyes have not turned red and I have not grown this magical tail that people say I'm just fine.
Right.
Because there's a lot, as you say, misinformation and disinformation. So I think really what makes people comfortable. My mother is really a better person because most of her high school classmates, they all got vaccinated,
Right.
but because each one knew each other, and then those that were of her age range, because that was a lot. The hesitancy is like younger and older. The middle
Right.
people, like our age, it's like, yeah, okay, I can do the research. I feel pretty comfortable. I see somebody I know, etc. But the older people, as they saw somebody else got it, and again, of course, they are just fine. Everything is good. Then they say, I'll go ahead and get it because, as we know, it has affected African Americans, especially older, that have, like I say, underlying conditions the most. So
Right.
I think that has been the biggest thing. The one thing that has concerned me, I went to go get my hair cut and I wanted to see what the protocol. I was vaccinated and I was just asking the bar, he's like, "Oh no, Mr. Campbell, I'm not getting that. I'm not getting that." But I'm like, you got people coming in here that are
Right.
not vaccinated, so you're really putting yourself at harm and
Right.
stuff. And I'm telling you, I at that time I had probably was 4 weeks in and I'm fine. There's
Right.
nothing wrong with me. I feel pretty good. And so if you need somebody that has some common sense, I got it.
Right.
So you're
Right.
fine. So I think he said, "Oh, well, I'm gonna think about it because my mama, because his mother basically told him not to come around until he gets it, gets vaccinated."
Right. Right.
So that's really the thing that has concerned me the most is that the misinformation that so quickly spreads on the platform that most people use, Facebook and things like that, and they're constantly adding new things or recycling things, to
Right.
tell people not to get it. So which is kind of disappointing.
Yeah, and what's sad about that is that Facebook will continue to put that on people's timeline because it's a popular story. So their algorithm says, "Oh, this is popular." So even though it's misinformation, it keeps popping up because people keep sharing it and liking it, and so they say, "Oh, let's move this to the top of the timeline," because they're really just wanting you to stay on Facebook to see the ads, not So I don't want to get dinged for that. So, Dorothy, last question for you is, are you encouraging folks to get vaccinated? Or are you just kind of saying you're staying neutral? People ask you, "I'm good." Are you saying, "Hey, look, this is my experience with the vaccine. Um, I'm good. I think you'll be safe."
Yes, I try my best to encourage all my friends, my coworkers, especially the ones that I do know that hadn't been vaccinated, to let them know that, hey, it hadn't did anything to me so far, and I'm good. So that's just about how, I let them know. And then also, like, we have had maybe, I know in my church, it's like 3 to 4 members that has passed, like, back to back, like in this year. So, and I use that, and I always say, hey, do you want to live or do you want to die? And I know you don't. You want to be here. You have kids, you have grandchildren, brothers, sisters that you want to be here for. And if you don't, then you're taking a chance on losing your life. So that's what I explained to them.
Amen. Amen. So, final question for you, Ms. Campbell, is what do you say? What do you say to Mississippians about, hey, look, I know you're hesitant. I know, I know there's a lot of misinformation, but trust that this vaccine is safe.
Well, I think the biggest thing is, again, it goes back to that Mississippi spirit of working hard, overcoming things, and living a long time. You can't let a virus stop what God has already ordained for a long life. So you got to use common sense. You got to get the information, because that is what hurt me the most. Two of my mother's neighbors, and again, people that I grew up with, their
Right.
parents passed away. And again, they would have lived a long time. And it's heartbreaking when you see people that are 75, 76, 77 years old, that, like I say again, most people in this neighborhood, they're going to pass 90 without blinking,
Right.
So that's the thing that I try to tell. Understand what's going on. Look at all the other people. Do not believe the misinformation that's out there, because you're taking up, really, to me, it's the risk factor that you're taking. So you don't get vaccinated. Look at what can happen versus when you get vaccinated. See, to me, that's a no-brainer right there. So
Right.
that's the biggest thing. So for me, I'm more of an undercover advocate. Like I said, I kind of send jokes to people. Hey, I'm still here. Me and my mother are getting ready to go take some trips. You know what I mean? Now you can be,
Right.
depending on hoping that people are washing their hands and are not, again, now people have to have this honesty. Yeah, I'm not wearing a mask because I'm vaccinated, when we know they're not. So why even put that in your, in somebody else's hand when you can put it in your own?
Amen to that. So thank you all for joining us. Hang around. We're going to have a panel discussion at the end to kind of get everybody's final thoughts. But thank you, Dorothy. You worked it out. I'm glad you were able to join us this evening. So thank you for that. Next up, and Steve, as we're switching to our next guest, Steve brought up a good point. I hadn't seen my mother in over a year, right? I forgot about 2020. And it's like, it did happen. And I just saw her recently, a couple of weeks ago, because I was fully vaccinated. She was part of the early group because she's older, like Steve's mom. She's in her 70s. And so she was part of the first group, early adopter of the vaccine. And it was just a nice experience to be able to go see her in person and to not have to wear a mask, because we were both vaccinated. I was in her house and we were able to not have to wear a mask and be able to interact like we used to. It felt comfortable. And so I felt much more at ease being able to do that because I was vaccinated. I knew I wasn't bringing anything potentially bringing anything into her home that could harm her or her husband. And so I was really, really happy about that. So when we're talking about making it personal, that's my personal story with regards to being vaccinated. So keeping it moving along, we've got Dr. Amber Johnson. She is a Mississippi native. I had people in the chat room. I said, "Where is Dr. Johnson?" Like they was looking for you. So she is here now. Here's Dr. Johnson here live in the flesh. Mississippi native, now a Maryland resident, but she knows, and when you grew up in Mississippi, you know about Mississippi. It's something that everybody that I have met from Mississippi, from Steve to other coworkers, they live Mississippi. It's part of their spirit. It's part of their DNA, so to speak. And so we wanted to have you on to kind of talk about what are you hearing? What are you hearing from people back home with regards to the vaccine, and if they are getting vaccinated, if they're not, what do you think? What are you hearing?
So most of my family, if not all, has already been vaccinated. I know there are lots of people who haven't been in Mississippi. I also know just in the southern states overall, there have been a lot of, talks and controversy around getting the vaccine, whether they should stay in or not. Just, the southern states have kind of been wide open. Not just Mississippi,
Right.
Florida and Texas on a whole level as well.
So when I dropped all those statistics, were you surprised that Mississippi was that far behind with regards to getting vaccinated?
No, I mean, with a lot of other things, just being, completely transparent. If we look at, a lot of other categories, a lot of the southern states are, kind of fall behind on some things, be it education, health, financial, literacy, and things like that. So no, it's not surprising whatsoever.
Now that you're out of Mississippi, and you've had some experience, 'cause I know you got your PhD at Purdue and you've gone to multiple schools. What are you seeing now? Like when you look back, okay, what have your experiences outside of Mississippi made you think about what it was like growing up in Mississippi and some of the attitudes that might be formed about the vaccine, especially, and then when we just target Mississippi, because you're right, it's the South. We did Alabama on Tuesday, and they were the exact same way. We got Florida and Louisiana coming up, and they all cousins. We did Texas before; they were all the same way. So we're just going to say the South. What do you, now that you've been in the Midwest and you're in Maryland? What are you noticing in terms of the differences in terms of the cultures of those areas?
I think it's just exposure and access to resources, to information, and the way the information is presented. So we talk about the vaccine and why people aren't taking it or why they are taking it. They're just how different communities, like you can't communicate with people the same way. Everybody doesn't get it the same way. We know this from just being in school, right? And so communicating this information about the vaccine or whatever it is, you have, especially in the Black community, you have this history with, health and medicine as this, negative history. And so going into these communities like, hey, this vaccine is great. And this is the quote unquote cure for COVID or the mitigation for it. And expecting people to just be like, oh, okay, cool, I'll take it. Like, no, that's not how that works. So, meeting people where they are and, the resources. So being in Maryland, being in Indiana, I've definitely seen a difference in the communities where, how information is dispersed.
Okay.
And just being receptive to the information. So I am very proud to be living in a blue state for the first time in my entire life. Feels awesome. And so with that, I mean, I have noticed some differences in how things are, like how everything's been operated. So for instance, Maryland shut down early.
Right.
Like Governor Hogan was like, no, we're not doing this. Y'all staying in the house. Like we wearing masks. Right. So just seeing those kind of differences have been like just completely eye-opening.
So as Brother DeBerry mentioned earlier, do you think it's got to be a more one-on-one approach in the South? We've got to bring in the leaders, bring in like especially like the church leaders that can talk to their congregations, that their congregation trusts what their pastor's saying more so than some outsider. I think, one time we had Dr. Dawson, Martha Dawson. She is the president of the National Black Nurses Association. And she said she was, in a rural county in Alabama, and the National Guard showed up and they were dispensing vaccines, but they were dressed in fatigues. And she said the people in the community thought it was a takeover. That they're coming in with the health, with something that's going to help them. Like, you got all these military folks with dressed in fatigues. They're like, no, so do you think it with our Southern sensibilities, and I can say that because I'm from the South, with our Southern sensibilities, you think it's got to be more of a one-to-one personal approach with bringing with trusted members of the community that's going to be able to deliver that information versus coming from, even if it's coming from Washington or people that have got all these great degrees, they're not trying to hear it.
So first of all, with the National Guard showing up, that is intimidating. And I've already had the vaccine. And if the National Guard shows up at my house, I am giving the vaccine back. Okay, y'all can have this back. I don't want it. So yes, I can see how that can be absolutely intimidating. And so your point about, having the community leaders step in. So one thing, I think there's so many opinions about this, and the facts get lost in that. Not only do the facts get lost in that, the people aren't heard. So you hear a lot of attacking and like, you need to take the vaccine, you got to take it, and this is why. But what about the people who are actually putting this in their body? You're not asking them how they feel about it or what are their concerns. It's more of telling them what they need to do. So even with the community leaders, I still think there has to be a conversation. So, I mean, one-on-one in a sense where not every individual person, but, in an intimate way, you're telling people to introduce something foreign into their bodies, into their lives that they don't know much about. So you hear CNN, you see Facebook posts, you hear, you're at church and you hear the pastor in the pulpit is saying, all the things, and these things are contradicting each other. So I absolutely, like, there needs to be facts, and then there needs to be, the people need to be heard. So
Right.
whether people are, decide to take the vaccine or not, you still have to practice, proper safety habits, right? So being, proper hygiene, washing your hands, cleaning your groceries and things like that, keeping your distance. So whether you've been vaccinated or not, I think that's really important. So sharing those different things is important.
Right. And I got a question, and I know you're not a medical doctor, so if you don't know the answer to this, but you can just say that. But this is one of the things that I've found to be most curious. Why do you think some people are more concerned with the long-term effects of a vaccine versus concerned with the long-term effects of having COVID?
So I think one of the things I think about is, so we have all these other like illnesses in the world, right, that have been around for many years, and we don't have any cures. We don't have real mitigation for it. And then COVID comes along, in less than a year, we get a vaccine. and I understand that different parts of this, vaccines have been given out for many years. There's an understanding of different components of the body, and like, okay, great. But all of a sudden, we throw all these resources at this COVID vaccine, and it's great.
Right.
But then you have somebody's grandma or uncle sitting here that's been dealing with, COPD, for instance.
Yeah.
And we don't have any real mitigations for that.
Right.
So that concern, that's a real thing.
Right. Right.
So, I mean, I think that, looking at just history with medicine and just how things roll out, and people don't want to be the first they don't want to be the test subjects, right? You don't want to be the sample size,
right? Right.
So people I feel like are kind of waiting around to go, okay, let's see if the first batch of humans make it through this, and then maybe I'll get it.
That's a good point, and I appreciate you being honest about that, because you're making a good point in terms of there are other illnesses that have been around for such a long time, and we haven't been able to get a handle on that. COPD being one of those, and then now we've got in a little over a year we've got this vaccine, and
less than a year,
less than a year. Less than a year. You're right. They developed the vaccine in less than a year, and it's great, and it's working properly. Now, yeah, there's reasons for that. There's absolute reasons for that in terms of if you take all of these drug companies and say, look, you don't have to worry about putting your own money into R&D. They were given money for R&D. mRNA technology, that's the technology they used to make Moderna and Pfizer, had been around for years. The vector technology that they used to make the Johnson & Johnson, been around for years. So they didn't create any new technology. They just applied that technology to this particular virus, and the government removed the restrictions of, okay, you don't have to use your funds. You're giving you the funds. We're going to buy all of the vaccines that you make. Everybody come together and create it. And so I think that's how, but it's hard to process that, right? You say, okay, well, if you could do that with this one, why can't you do it with cancer? Why can't you do it with diabetes? Why can't you do it with hypertension? Why can't we do it? So I definitely understand your point, and it's a good one. And I think after we get through this pandemic, we really need to start looking at how we approach other illnesses. And you're making a point without even making it. I think we have to approach other illnesses in a different way in order to get past them, so people don't continue to live and suffer with these illnesses. So I definitely agree with you on that. Man, see, Dr. Johnson, that's why they were calling for you. I was like, man, smart.
I mean, you have to look at, you got to see what the people are saying. So, everybody, and I also understand research, right? So I am not a medical doctor. My PhD is in computer science. If you need help with your operating system, do not call me, call Best Buy. But I do know, I'm kidding. But no, so, I'm not a medical doctor. But you really have to look at, so even understanding research, there's, you have a sample size that a lot of times doesn't include the communities that are saying, hey, I don't want this vaccine. So if you historically, you look at things like hypertension, you look at just diabetes, like Black people in particular being diagnosed and given different medications, their research wasn't based on a population of Black folks.
Right.
Right. And so I know that as a researcher, so ask I don't know, the average person about this. they probably don't even know this. So somebody could be out there be taking blood pressure medicine based on some information of some middle-aged white men from the Midwest.
Right. Yeah.
So looking at that kind of thing, like, I totally understand why people are like, hey, how y'all know this much information in 9 months? And how much information was excluded from the research that was done with the COVID vaccine.
Absolutely. Well, that's why we're here. That's why Black Doctor exists, because we wanted to give information that's culturally relevant. And that's why our tagline is where wellness and culture connect, because we want to be able to give people information, health and wellness information that's culturally relevant. And so I would tell anybody that if you want to get information about Black folks and COVID and the vaccines, we've got a COVID resource page on blackdoctor.org that you can find out about your area. It's very specific. There's a number of videos that you can watch, smaller, videos that you can watch about how the vaccine was created and all of these different things. And so there's a treasure trove of real information, not disinformation, but real information there on the blackdoctor.org COVID resource page. So that was a shameless plug, but it's definitely there, and it is for people to be able to use that information. So thank you, Dr. Johnson. Hang around. We got one more guest we're going to get to, and then we're going to get to our panel discussion. So last but certainly not least, we have Dr. Brenda Collins with us. How are you, Dr. Collins? Are you on mute?
Yes, I was on mute.
It's fine. It happens. Look, I do this all the time, but it still happens to me. So Dr. Brenda Collins, she is a nurse practitioner manager at Alcorn State University at Family Clinic. And so she also trains. It's my understanding that you train nurse practitioners. Is that correct? So yes. She is the nurse practitioner for nurse practitioners. So just to let y'all know that Dr. Brenda is not playing. And she's very modest because she didn't put Dr. Brenda Collins in there. So I will keep throwing that out there. She is very accomplished in her career and teaching the next generation of nurses. And so when we're talking about the next generation of nurses, what are your students saying to you when they're talking about COVID and the vaccine? What are they saying to you, and what are you telling to them?
Well, it's split. Some students, because most of my students are registered nurses already, and they are practicing, and they're just getting an advanced degree. So some of them work on COVID units, and so they take it very seriously. And the lack of supplies, PPE, no masks, buying your own equipment and supplies, they had a rough year. So some of them take it very seriously. And then there are very few, but there are some who, they do not think COVID is that big of a deal. They've worked on units and seen patients with it, but it hasn't affected them personally. And to me, I don't know what kind of heart they have to work on a unit and not be affected by what you see. But there are some, not many, but there are few. And so it's been a rough year for nurses.
Yeah, and when we talked to, like I mentioned earlier, I talked to Dr. Dawson about this, and one of the things that she mentioned was the mental health, right? Because because nurses have to treat the patients that are coming in presenting with COVID. They have to continue to monitor them, and not all of them make it out of the hospital. And so that stress of seeing, and she's talking about nurses that are reporting seeing, having 5, 6, 7, 8 patients die in a week, especially when COVID was at its height, having that many, and the stress of understanding that these people are no longer coming back, and you've got to deal with that and go and continue to move on. What are you talking with your nurses about mental health, taking that time, making sure that they are mentally prepared to go in and do their job effectively?
We are promoting a lot of self-care. Compassion fatigue is at its highest right now because we care, we love on our patients so much, and it's taking a toll on the nurses. And so I've seen a lot of compassion fatigue. And so we're pushing self-care, care for yourself, because if you don't care for yourself, you can't care for your patients. And you're definitely not going to be able to learn anything. And so that's the big thing. And I've noticed it a lot. I've seen conferences, I've attended conferences, and compassion fatigue is one of my research interests. So it's something that we have to pay attention to right now, because COVID brought a lot of stress with it in the workplaces. And then you go home and you got a family to deal with, and you're kind of wired and frustrated, and they got to deal with you and you got to deal with them. So it affected not just the workspace, but home life too.
Absolutely, absolutely. So, you know, as we talked with Brother DeBerry earlier, Black folks, we tend to be a little bit conservative, and we're slow adopters of new things. What can we do to help Black people over with some of the skepticism about getting vaccinated so they can protect themselves and their family members?
Well, you know, y'all hit it on the head when you said the disinformation and misinformation, because, you know, my husband is a pastor, and he from the pulpit, you know, our church developed a policy. I wrote a policy based on CDC guidelines and Mississippi State Department of Health guidelines, and I combined it and I developed a resource for the church. And I did a lot of education every Sunday, every chance I could, and almost all, I would say about 89% of our congregation has been vaccinated. And so that's just one way. And at Alcorn State School of Nursing, we have partnered with the Delta Health Alliance, and we have applied for a $500,000 grant to do it's COVID re-education. It's basically going out into the communities all over Mississippi and educating people and trying to get rid of this vaccine hesitancy. And I mean, I've heard a guy in the store told me the other day, well, you know, it's a sign of the beast. And I'm thinking to myself, well, you know, if you got Jesus in your heart and all that, you won't have to worry about the beast. But, you know, what can you do when they argue with you? I had a patient whose husband had COVID-19 and she refused to get the vaccine. So they sleep in separate bedrooms. I mean, really, you know, so it's that hesitancy is there. And, you know, I think we need to do more media and because media presence, because I've only seen one commercial that, you know, that talked about masks, and we're about to take the masks away. But if everybody go on and get vaccine, that was the only commercial. I haven't seen anything. And I think, you know, more of us, we need to be on those commercials. Gotcha. And, you know, that's what I think needs to happen.
We need to see people. So basically, we need to see people represented that looks like the population that they're targeting, right? So if you're trying to talk to Black folks, you need to have Black folks in the talking to Black people, right? And so that's what we're trying to do here, and that's why when we develop these programs, because we've got a series of these programs. When we develop these programs, it became very important for us to talk to the people from the community, which is why when we're talking to Mississippi, we want somebody from Alcorn, we want people from Jackson, we want people from Holly Springs, we want people from all over the state, because they can speak to directly what's happening, and then they can take this information back to their community. So you can talk to, hey, look, we did this wonderful program. There was a doctor from Jackson on there. There was another brother from Holly Springs, and they said this, right? And so that'll help you get that next person to go ahead and get vaccinated. So you're right. We have to have that one-on-one approach. We have to have people that look like us, that represent us, that are for us, and that have been in the community, not just coming in to deliver a vaccine. People that have already been there, like your husband in the church,
right?
They've already been in the community, and then they deliver that information because they've already been trusted. They don't have to establish trust in order to get that information out. And so, you know, I didn't want to put words in your mouth, but that's what I'm hearing.
I know. Yes, we're also gonna we have a task force at Alcorn State, and we're going to try to set up pop-up vaccination sites on campus during move-in day, and vaccinate families also, not just the students and the athletes, but the families. Just get them by surprise. Hey, you want to get this vaccine? And I think if we're there, we're nice. How you doing? Welcome to Alcorn. Would you like a vaccine with that? You know, so whatever it takes by any means necessary.
I think that's great. So Alcorn hasn't established because I know some schools are establishing a policy where students have to be vaccinated before they can come back to campus. Alcorn has not done that.
Not to date that I'm aware of.
Okay. So I
we
think
strongly encourage it.
That's
strongly
good.
Encourage it, almost like the my niece is in healthcare and the facility where she works, they said even with testing, they said you don't have to get tested, but to work here you have to. You don't have to get the vaccine, but to work here you have to have it. We're not making it mandatory, but you have to have it. So yeah.
It's semi-mandatory, kind of like, through other ways. I think Dr. Lenoir was making that point earlier in terms of I don't think it's going to come from the government because that's too heavy, right? If the government says, that's too heavy, but it's coming from private businesses, it's coming from organizations, it's coming from social places. So like if you are a member of a club or a fraternity sorority, if you can't come to chapter meeting if you're not vaccinated. And so that might pressure more people to get vaccinated, come to church. Hey, come to church. Vaccinated people can sit in the front pews and not have to wear their mask. Hey, you might want to go sit to your front pew and because surprisingly in our community, not surprisingly, that's very important. That's very important to be able to worship together. And many of the people that I've talked to, they missed, going to the sanctuary. I know virtual church, it can happen. People have really pivoted, but there's something different about being able to go in to the sanctuary with a room full of believers. And so I think Black folks in particular want to get back to that. And the quickest way to do that really safely is to be vaccinated. So I really hope. So I wanted to say thank you, and I want you to hang on because we're going to bring back everybody. So, so Alexis, you can bring back everybody, but I want to say while we're bringing everybody back for our final discussion, I want to say thank you, in particular, to Alcorn State University School of Nursing, the Family Clinic. Thank you so much. I also want to say thank you to the National Black Nurses Association President, Dr. Martha Dawson, for bringing Dr. Collins to us. So I just want to give them a special shout out for everything that they've done in our partnership here with Black Doctors. So I think we've got everybody back. So we've had this whole roundtable discussion about Mississippi. We've been an hour and 20 minutes in. I know it doesn't feel like that, but an hour and 20 minutes in, and we're going to go around and get some final thoughts. So we'll start with Dr. Lenoir. What are some final thoughts that you'd like to leave with our audience this evening?
Well, I'm really impressed with the effort in different ways that everyone is trying to get people vaccinated. I think that if we had had the opportunity to organize a rollout, many of the principles of communicating with our people that Amber brings up or Dr. Collins brings up with Mayor, and we used our own collective wisdom, we could have probably messaged a lot of this a little bit better. For instance, last night, for some reason, I seemed to fall asleep with podcasts. I don't think I've ever listened to more than 15 minutes of any podcast. But last night, I happened to hear the New York Times podcast on the woman who invented the messenger RNA. Right. She was from Hungary. She worked for 10 years trying to get people to understand the value of messenger RNA. She moved to the States. She moved from job and research places to research place until she found an institute and a small company that would understand the philosophy of what she's done. So her work on messenger RNA has been going on for over 15 years. So that's one of the reasons. The other thing is one of the problems in research on medications, Dr. Johnson, is that the FDA ties you up so long in the process that it ties you up for years with nonsensical questions and things that are not relevant. And so many drugs that should have been in market some time ago, like the Alzheimer drugs, I forgot their name already. I don't know whether it's because I need the drug itself, but these drugs have been available for almost 4 or 5 years. And so I think that what happened was once the larger population was threatened, then all of a sudden the wall comes tumbling down. Now, here's the thing that that in my explanation to some of the parents and to some of the people we talked to, Tuskegee was a situation where we didn't get treated. It wasn't a situation where somebody treated us with something that we had a problem with. We didn't get treated in Tuskegee. And so now we're going to give up on a situation where we are going to get treated, and they're going to get treated right along with us. That ought to tell you something right there. That they ought to get this vaccine quicker than we can get it. And so there must be something going on here. But I do think that the messaging is important. I think trusted and vetted sources is important. I do think that what Black Doctor does, what we try to do at the African American Wellness Project, is so important. We had a guest who talked about compassion fatigue. I think she's the queen of compassion fatigue. I don't remember her name right now, but she wrote a book. She would give seminars all around the country. And I recognized myself right in the midst of that passion fatigue discussion, something I really never thought about as a 40 years of practice, that it does wear on me and my family. And so consequently, I'm so proud of what African Americans have done always in times of difficulty and trying to do the right thing for our own people. And I'm extremely impressed with what you're encountering. Having grown up in the segregated South of Texas, I know the barriers that you're facing in Mississippi because they're not that different. And I'm so proud to be a part of this panel.
Well, thank you for that. And there's one thing I did forget. So Alexis, if you could put up the questions that we want our audience to answer, if you could just put up that slide really quickly while we're moved to. So we would like to get your feedback. If you're watching this program, if you're still watching us here, which speaker resonated with you the most? What information was most helpful for you? And most importantly, you could put this in the comment section. Did this event help you feel more informed or confident in making a vaccine decision? So any one of those questions or all three, put your answer in the comment sections. We'd like to get that feedback from you. Thank you for that, Alexis. So Brother Campbell, what are your final thoughts?
You know, it was funny. I'm sitting and looking at people from Alcorn and JSU alumni and us being Florida A&M alumni. I saw something I thought was very interesting. The two groups that were most likely to get the vaccine were affluent whites and HBCU alums. So that to kind of tell you something. And I'm going to what Dr. Lenoir is saying, look at who's getting it. To kind of tell you. So as Donald Trump didn't want anybody to know, but Donald Trump was one of the first people to get the vaccine and his family.
He was. Yes, he was.
So we should understand, to Dr. Lenoir's point, there's a reason why, because they know this is serious. They know this affects people. And because of our HBCU collective that we have on this, we are able to understand, get great information out, get honest information. We're able to ask questions without being embarrassed. Because you do have people that will, there's no such thing as a dumb question. But you have people, because lack of knowledge from medical standpoint, they want to know, hey, is this going to make me infertile? Is this going to make me have blue eyes? You know, different things like that. And I think we're able to give each one honest answers. So I think that's the great thing about it, is that we are always leading from the front. We're never leading from behind. So, you know, that's my biggest thing. And I'm just going to leave it at this. To all you Jackson State people, FAMU will see you on Labor Day. We'll see you on the SWAC. And to my friend down in Alcorn, we'll see you probably in the conference championship when we go. So, I'm sorry. I just had to get that out there. I'm sorry.
I think this is probably why people are not getting the vaccine, because all the misinformation. So many different. I just want to, as a Jackson State alum, a diehard Tiger. Okay.
See, we started turning. We were so.
I'm sorry.
It was all love.
I could not help. It was too easy. It was a layup. But I do want to say one quick thing. My grandfather graduated from Jackson College in 1938. He was in a graduating class of 12. So I understand the power of, again, what these schools do and how they are leaders. They led, again, like you say, when we talk about vaccines and things like that, we look at some of his documents, and when they were going through things and they had to get vaccinated and stuff like that, and I think it was polio vaccine that was coming out that Jackson State was doing a rollout at that time. Well, a little bit later, but they called all the alumni, you need to get your kids and things like that. We have letters from that. So we've always led in this category.
Amen. Amen to that. Brother DeBerry, you're on mute.
Let me unmute. Before I give my closing statement, I just want to say to Steve, welcome to the SWAC. To Brenda, way to go, Braves, and obviously to Amber, thee I love. I just want to say that, you know, the scripture reminds us that my people perish from a lack of knowledge.
Mm.
And I think what we are doing here tonight, Ellis, I think goes a long way towards alleviating that lack of knowledge. Because I think people, as Dr. Lenoir was saying, when you start talking about Tuskegee or whatever that people are talking about, they don't have the knowledge. And as a result, we pass along misinformation. But as Dr. Johnson was saying, we need to really seriously invite our people to, it's okay to be skeptical. It's okay to want to research and learn. But once you research and do the research, at some point in time, you can't research, analyze, and discuss it to death. At some point, you have to accept the research that you're gathering as either being valid or not being valid,
right,
and move on. But we hope that we can get people to realize that the research that we are doing and so many others are doing is in fact valid and will come to the table. I just want to thank Ellis, and I want to thank all you guys with BlackDoctors.org for doing what you're doing and continuing to bring information and to give us an avenue by which we can communicate and to our people and to this country. Bless you, my brother.
Thank you. Thank you for that. Dr. Johnson.
Hey, thank you for having me. So I think this has been a really good discussion with a lot of different views on this, and hopefully some of it resonated with someone. And so I just like to say, I just hope that we can listen to each other. So we have all this research, we've been educated on all these things, but one side is pushing the vaccine, one side is saying, and you still have to listen to both sides. And so I know that, some scriptures were brought up. So I myself am a believer, and, for those who are, like, Jesus listened. He already knew, but he listened. Mm-hmm. And so I think it's super important to listen. And so I don't know, maybe we need about 14 minutes and 59 seconds. As Dr. Lenoir said, he doesn't listen to over 15 minutes of a podcast. So if we can get the first 14 minutes in there and get some people listening for about 14 minutes, I think we might be good.
Amen. Amen to that. Thank you for that. Dr. Collins, you're on mute. Dr. Collins, you're on mute. Yeah, it's all fine. It's fine.
This is the only time I'm quiet, okay? So my husband would appreciate that. But I've enjoyed this. I've learned some things myself, and it's just good to be among the brethren, people who have a mission and a purpose and are fulfilling that purpose. And we have work to do. And I know I'm going to do my part. Dr. Shirley Evers-Manley, our interim dean, she's 100% behind anything we do to get out and get this word out. So we got to get people vaccinated. We got to combat this disinformation with positivity and good information. We got to fix it. Everybody's, lives depend on it, but I've enjoyed it.
Amen to that. Amen to that. I want to echo all of that. So one of the things that I've been echoing throughout these presentations has been, we've got to seek information and not affirmation. And get that information. And I'm going to steal a little bit from Brother DeBerry, is that we got to take that information and we got to add some action to it. We can't just keep gathering information. We have to have some action associated with that information. And that action is your decision. So not getting vaccinated is a decision, is an action. And there's consequences for that too. And so you can't just say, oh, I'm not getting vaccinated and not feel like there's any consequences. So there's that piece of it. I will say that ultimately we do have to get out there. I agree wholeheartedly with Brother Campbell. As people that all went to HBCUs, we know we have a network of people that we can reach out to, that we trust, that have the education, the knowledge, and the experience, that we can reach out and touch and say, hey man, I can pick up the phone and say, hey, look, tell me about this. And I'm going to trust him. That's how we are as a community. Doesn't just have to be an HBCU. It could be a church member. Hey, Brother Johnson, I heard you got vaccinated. What was your experience? We have to do that. We cannot expect the government and other folks to tell us about this. Let's talk to each other. Let's trust one another. Let's trust our community and make informed decisions. Push out the disinformation, push out the misinformation, trust ourselves, trust our communities, so we can make the best decision to keep ourselves and our community healthy. I want to thank everybody for joining us this evening. Thank you all for hanging out with us. Thank all of our guests, Alcorn State, especially Nursing Association, National Black Nurses, Holly Springs, Jackson, Tunica, all of the cities in Mississippi. Thank you all. We hope you all make the best decision for you and your family. Thank you for joining us, and we'll see you next time. Next week, we got Louisiana and Florida. We're staying in the Dirty South, and we're going to talk more about getting our community safe. Thank you again, and have a nice evening.